Hi, I am Dr. Saqib Mansoor, and this is to recapitulate that we have started studying the brain stem. So, in the brain stem, as we know, it consists of three parts: the medulla oblongata, the pons, and the midbrain. We have already discussed the structure, external and internal, and the applied aspects of the medulla oblongata. I've written the link below. So, today the focus is on the pons, and I will discuss with you the anatomy of the pons. So here, from a different perspective today, you see this is the embryological origin of these structures, adult derivatives of these parts of the brains. So you see there are three primary vesicles in the embryo. First of all, this is the forebrain, the midbrain, and the hindbrain. Three primary vesicles in the embryo: forebrain, midbrain, and the hindbrain. These are the derivatives. Then from the forebrain, there comes the telencephalon and the diencephalon. And from the telencephalon and the diencephalon, they're formed two secondary vesicles. And from the mesencephalon, the midbrain forms only one secondary vesicle. And from this hindbrain, it formed two secondary vesicles. So there is a total of 5 secondary vesicles. And from this telencephalon, the adult derivative from the walls, these are the walls, these are the cavities. These are the walls, these are the cavities. From the walls, and these are the derivatives. The cavities in adults, the walls of the telencephalon give rise to cerebral hemisphere. And from the diencephalon walls arises the thalami, the hypothalami, and the epithalami. These are the structures. And from this midbrain, this mesencephalon, of course, only one midbrain is derived, whose cavity is aqueduct. So then you see there is the hindbrain. This is another secondary vesicle giving rise to this pons and cerebellum in the adult. And that is myelencephalon, which gives rise to medulla oblongata in the adult. Right? So the three parts of the brain stem, which is the medulla and the lower part, coming from this myelencephalon, and then the pons coming from this metencephalon, and the midbrain, of course, from the mesencephalon, the midbrain. So these are the parts coming from embryological origin, and these are the cavities of them. The cerebral hemisphere has the lateral ventricles, the thalami, etc. The diencephalon has a third ventricle, and this midbrain has an aqueduct, it's a duct. So the pons and the medulla. Pons in the upper part has the upper part of the fourth ventricle, and the medulla in the has the lower part of the fourth ventricle. So this is the fourth ventricle formed by the pons and medulla. So moving on, you see again. So these are the parts of the brain stem, very important structure. So this is, it is lying anterior to this cerebellum. This is anterior. So this is, it is obscured, especially this pons is obscured by this cerebellum. It overlays, the cerebellum overlays this pons. So these are the three components of the brainstem. Again, we are recapitulating. This is the lowermost medulla oblongata, continuous below with the spinal cord. Above is the pons, it's broad portion pons, the bridge, I tell you soon. And above there is the midbrain. This is the thing. So you see the functions of the brainstem in general or broad. First of all, it's a conduit for most of the ascending and descending tracts. And then cranial nerves are associated with it. And the third is they have all the important vital centers, the respiratory centers, the cardiovascular centers, and the blood pressure control is over here. And also the consciousness control, the arousal system due to the presence of the reticular formation. So you see there are 12 pair of cranial nerves, all enlisted here in this picture. So out of these 12, you leave these two, olfactory and optic. All of the from 3 to 12 arise from this, connected with this brain stem, three parts. either they're afferent nuclei, and they're bringing the sensory part of the sensory nuclei, or the efferent fibers, the fibers going from the efferent motor nuclei to the outside. So you see to the midbrain are attached two cranial nerve nuclei, third and fourth, third and fourth. And this you see today we are focusing on Pons, and it is having fifth, sixth, seventh, and eighth cranial nerve. So these are the roots emerging. This is one, fifth, sixth, seventh, and eighth. And then we already discussed this in my previous lecture. This is the medulla oblongata. So this is the low rest of the four nerves are attached with that 9th, 10th, 11th, and 12th. So this is layout. So, and this is again, you see, this is Pons, and posteriorly there is the cerebellum. So there are that. So this is the thing. And Pons, generally you see over here, it is divided into an anterior part and a posterior part. The anterior part is known as this part, anterior 2/3. It is known as the basilar part of the base of the Pons. And the posterior part is the tegmentum, this part here you see. This is the tegmentum. So these are divided by a trapezoid body. We will discuss later very soon. So this is the division. Then we see the external structure of Pons, first of all from anterior surface and then from posterior surface. It has an anterior surface. This is the Pons, you see. It has an anterior surface and the posterior surface. This is posterior surface of Pons. And this is an upper border and this is the lower border, right? So you see, first of all, this is the Pons. You should note one thing, that its length is only 1 inch to 2.5 centimeter, but its width is greater than its length. It's more wider than long. So there are present the striated appearance due to the superficial transverse pontine fibers. They give it a striated appearance. And we'll discuss what is the feed of this, where they come from, and what is the feed of the transverse pontine fibers. And they give it a striated appearance, and that broad structure is said to be connecting the Pons to the cerebellar hemispheres, left and right cerebellar hemispheres. So this is the Pons. Here you see, this is the superior this is the cerebral peduncle of the midbrain. This is the cerebral peduncle of the midbrain, and this is the middle cerebellar peduncle. So middle cerebellar peduncle connect this Pons with this cerebellum, and you know the medulla is connected with the cerebellum via the inferior cerebellar peduncle, and our midbrain is connected to the cerebellum via the superior cerebellar peduncle. So these are the three peduncles respectively attaching the three parts of the brainstem to the cerebellum. So here you can see the anterior structure. This is a groove anteriorly. This is the basilar groove. This is the groove lying in the midline of the anterior surface of the Pons. That is called as the basilar groove. Here rests the basilar artery. This is groove for the basilar artery. And as I've told you already, there are the superficial transverse pontine fibers over here. Then as we go anterolaterally, there are, you see, these are the two nerve roots of our fifth cranial nerve, which is the trigeminal nerve. It has a medial root, smaller, and a lateral larger root, which is a sensory. M for medial, M for medial, and M for motor. Medial is a smaller root, which is a motor root. Medial is a motor root and a larger sensory root, because the sensory nerve supply of the trigeminal has to contribute to the sensations of the proprioceptive sensations of the cutaneous innervation of the face. So the motor nerve of the trigeminal is smaller because it has to supply a muscle of mastication. So this is the point over here. This is the two things over here. So here we then move to this inferior sulcus, the inferior border, you see there are three other cranial nerves which are lying from medial to lateral side like this. This is the sixth abducen. This is the seventh. This is the facial. Again, this is the sensory and motor component. This is the medial, which is the so medial is always on the medial side, which is the motor one. So sensory is on the lateral side. Good. Okay. This is the, you see a motor root, which is the medial, and this is the again the medial root. This is medial. This is the general rule, and this is the vestibulocochlear nerve. Right. So this is a layout. These are the fourth cranial nerves related with the Pons. And on the lateral side, you see this is the middle cerebellar peduncle. This is the middle cerebellar peduncle. This attaches the Pons to the left and right cerebellar hemispheres. That is a general layout. And on the anterior aspect, here you see this is the superior border, which separates it, of course, from midbrain. And here is an artery lying the superior cerebellar artery. And here at the inferior part, the artery lies the ICA, anterior inferior cerebellar artery. Then the external structure of the Pons from the posterior aspect. You could see this is the thing. You see, I told you the cavity of the this fourth ventricle is lying over here, right, where its lower part is formed by this medulla oblongata, and the upper part of this cavity is formed by Pons, the posterior surface, right? So we're studying the Pons. In the midline, there is the median sulcus. So it is a median sulcus in the midline, which divides the posterior surface of the Pons into two equal halves. Median sulcus divides the posterior surface of the Pons into equal halves. And lateral to this median sulcus, this is an elevation, which is the medial eminence. This medial eminence. This is the medial eminence. And the lower part of this is the medial eminence. The lower part is the facial colliculus, an even bigger impression. This is produced by the winding around of the nerves of the nerve fibers of the facial nerve around the abducen nerve. I will show you a separate picture for that. Then lateral to this medial eminence is very important. This sulcus limitans. This is the sulcus limitans. When it upper part has the substantia ferruginea. Substantia ferruginea, which is bluish gray in color due to the nucleus locus ceruleus. This substantia ferruginea, which is related with the stress and panic response, locus ceruleus. And it has the bluish pigment, bluish gray, which is the melanin. So this is, and lateral to this sulcus limitans is the vestibular area. Of course, this is produced by the underlying vestibular nuclei. So this is the posterior aspect of the Pons, which is limited by this posterior aspect of the Pons by the superior cerebellar peduncle. Here it limits that. Then this was the external structure of the Pons, and then we have to study the internal structure of the Pons. So what gray matter lies in that, and what white matter lies in that. So of course, gray matter would be mainly these four cranial nerves nuclei, which you know already. This is the trigeminal, then the abducens, facial, and the vestibulocochlear mainly, right? So this is a trapezoid body in that, and this you see, this is the sections. Two sections are made. The Pons for the study. One is the caudal part where the facial colliculus is present, and the other is the cranial part where the trigeminal nucleus is present. You see, this is the caudal part. This is the Pons. This is the caudal or lower part. Here the facial colliculus is present. So one section is made at this level, right? Facial colliculus. Here the most of the cranial nerves would be present, three, which were emerging, you know, like this, with all this abducens, this facial, vestibulocochlear, and this is one section made, and the other section, upper one, is made at the level of this trigeminal nucleus. So of course, these nuclei won't be present, and this will be the trigeminal nucleus would be amongst the cranial nerves, right? The wide matter amongst those both levels at this caudal level, the cranial level is exactly the same. The difference in the gray matter, which is mainly due to this nerve, this is the trigeminal nuclei, lower mode, these are the abducens and the facial and the vestibulocochlear nerve nuclei. So here you could see, I've told you already that the anterior part, this is the base anterior to the basilar part, and the posterior is the tegmentum. So what is the anterior most part of our tegmentum? This is this trapezoid body. Trapezoid body. What is that trapezoid body? It contains the fibers coming from the cochlear nuclei. Cochlear nuclei, vestibulocochlear. This is the 8th cranial nuclei. Cochlear is concerned with hearing, and then the nuclei of the trapezoid body. So they are forming a part of a path where it is the auditory pathway. So this is the trapezoid body. So this is anteriorly. This is the this anterior to that is the base, and this is lying in the most anterior part of the tegmentum. This is all tegmentum. And this is the trapezoid body containing lateral to it is the medial lemniscus. Medial lemniscus. You see, if you remember medial lemniscus in the medulla oblongata, it was, vertical like this. Here it rotates down, lying horizontally. It is rotated and to lie horizontally. So this is the medial lemniscus. Also not shown over here. It's basically 4 lemnisci deriving from a mnemonic, that is the my tongue speaks louder. This is the medial lemniscus, the tongue is trigeminal lemniscus, and speaks is spinal lemniscus, louder is the lateral lemniscus. So this is the medial lemniscus shown over here. This is the layout. As we see to the posterolateral part of this medial lemniscus, here is the motor nucleus of the facial nerve. This is the motor nucleus of the facial nerve, right? And fibers from this going, you see here in this direction, medially, upwards. Upwards. They produce a projection. This is around the nucleus of the abducens nerve. Here they go there, right? And there you wind around, come back between this trigeminal nucleus and this again facial nerve nucleus or the medial lemniscus, and they emerge anteriorly. This is the facial nerve layout, right? So this winding around as this motor nucleus of the facial nerve fibers goes in this direction, right? Upwards, medially, then again above this nucleus of the abducens nerve. Here they produce a projection, which is the facial colliculus in the floor of the 4th ventricle, lower part. This is the facial colliculus. So this is the then coming downwards, crossing this this is the reticular formation. This crosses it, and this emerging on the anterior surface. This is the facial nerve. So this is this phenomena of movement of the facial nerve nucleus, motor nucleus. This is the neurobiotaxis. Let me show this diagram, the direction of the fibers of this facial nerve, right? This is a transverse section viewed from the above rostral aspect and pons. And you see this is the facial nuclei, and here you see these are the fibers of the facial nerve going like this. Here I told you already, this is the abducens nuclei. Here it go upwards with this, they wind around. Here they produce a facial colliculus going like this downwards laterally and emerge from the anterior surface of the pons facial nerve. So what is neurobiotaxis? That this is, trigeminal nuclei, right? This is it's your spinal tract and nucleus of the trigeminal nerve. So this is the facial nucleus. So in the embryological life, this facial nerve nucleus was lying here, close to this, lateral to this nucleus, abducens nucleus here. It was lying here, and it was having a tendency to move towards this trigeminal nucleus. Here it moves like this, here to here to here, right? It comes to like close to this. Why? Because the trigeminal nerve and this facial nerve closely associated with the control of the face. The trigeminal nerve conveys cutaneous nerve supply from the face, and the facial nerve is involved with the motor nerve supply of all of the muscles of the facial expression. So this phenomenon of movement of this nucleus from here to here, from this aspect of to lateral of the nucleus of the abducens nerve, it moves upwards and then it finds around here, we medially, then downwards, coming it against it's anteriorly to it, and here it lies. This is the neurobiotexis. So this is the point of the our facial nerve, how the facial colliculus is produced. Then you see this was structures, you see, and this is you see abducens nerve, then the facial nerve, and this is the spinal tract of the nucleus of the trigeminal nerve, and this is the point. And as we move upwards, this is the inferior cerebellar peduncle, and anterior to that are the vestibular nuclei. Which parts of the vestibular nuclei? The 4 parts: lateral and superior vestibular nuclei are lying over here. Also, the vestibulocochlear nuclei over here, not shown here. So this is very important. Then this is the medial longitudinal fasciculus, the white matter, medial longitudinal fasciculus, lying on both sides of the midline. This is medial longitudinal fasciculus. They serve a connection between the nuclei of the oculomotor, then the trochlear and the abducens nerves, and is concerned with the lateral gaze and the nystagmus. There, so these are the medial longitudinal fasciculus. This is, you know, cavity of the 4th ventricle. Of course, this would be present cavity at both levels of the cross sections of the pons, at the caudal and the cranial. So this is the medullary, superior medullary vellum. So this was the structure of the tegmentum. You see, again, you see, this is the our reticular formation, right? Which can be concerned with awakening and consciousness present throughout the brain stem, reticular formation. And we again see this motor nucleus of the facial nerve is embedded deeply into this reticular formation. This is the trapezoid body I told you already, and no, anterior to this trapezoid body, this is the basilar part. And what lies over here? You see the corticopontine fibers. Corticopontine fibers come from the cortex, all the parts, the cerebral cortex, the frontal, the temporal, the parietal, and all the 4, the frontal, the occipital, the parietal, and the temporal. They all come, and these corticopontine fibers, and they come here and converge onto these pontine nuclei. So here are present the pontine nuclei, gray matter present in both sides. These are the pontine nuclei that the nuclear fibers converge, right? They converge, and from that arise the transverse pontine fibers. These transverse pontine fibers going on both sides, transverse pontine fibers. And these transverse pontine fibers go to the contralateral side. Here they go to the contralateral side, and they are the main connection between the pons with the cerebellum. This is the middle cerebellar peduncle form, right? These are the transverse pontine fibers, and these transverse pontine fibers run through these bundles of the corticospinal and corticonuclear fibers, and split them into small bundles. So this is the anterior structure, and there is a groove for the basilar artery. So that was the suction through the caudal part. So now moving on to the next section, which is at the, this I told you already, this is the facial colliculus. It's a unique picture going through that. So this is the summary. You see, this is the gray matter at the caudal part. There is our facial colliculus, facial nucleus, abducent, medial vestibular nucleus, spinal nucleus of the cranial nerve 5, pontine nuclei, and the trapezoid. This is the gray matter. This is the white matter. These are the fibers discussed you already, right? So this white matter would also be same at the cranial part, and gray matter would be replaced. So this won't be present, and these the three cranial nuclei, facial and abducent vestibulocochlear, and there would be present the trigeminal. You see first into that summary. This is the cranial part, main sensory and motor nuclei of the cranial nerve 5, pontine nuclei and the trapezoid nuclei were the same. The motor tracts are exactly the same. These are the tracts, sensory tracts. These are the motor tracts. These I've told you lemnisci. The three are mentioned. One is also the trigeminal lemniscus. I told you the mnemonic as well. My tongue speaks louder. So this is the section now discuss and focus on that. This is the cranial part with the present. What is present at that? Main sensory nucleus of the trigeminal nerve, right? Focus. And you see again this diagram to make a better concept. This is the diagram. You see this the first section discussed in detail. This was the caudal part. This was here. The facial colliculus was present, and these cranial nerves were present. This was 6th, 7th, and 8th, right? And now this now we are going to study in detail. This is the cranial part section, cross section. Here you see the main this trigeminal nucleus is present. This is the level. So here you see, right? So this is, you know, already this is the trapezoid body that we've discussed in detail already. And these are the lamellesci present, the medial and then lateral, and in between is the trigeminal and the spinal lemniscus. These are 4 lemnisci present over here. And this is spinal lemniscus. So this is the this is the, you know, very important. This is the motor nucleus of the trigeminal nerve. Here you see this is the thing. It's embedded in this reticular formation. This is a reticular formation, and this is the efferent nerve, motor root of the trigeminal nerve going into the substance of the pons, and they are emerging anteriorly. And this is the sensory root of the trigeminal nerve, and this is the main sensory nucleus of the trigeminal nerve. It is of course attached with the sensory nucleus of the trigeminal nerve, which is, and you see even here is present the not shown mesencephalic nucleus of the trigeminal nerve, and but I have to try to keep it very simple to make a concept for every level, undergraduate or postgraduate. This is my discussion for this neuroanatomy part, the pons. So this is the reticular formation. Again, this medial longitudinal fasciculus, right? I told you this is controlling the synchronization of the 3rd, 4th, and 6th cranial nerves. And this is the cavity of the 4th ventricle. So this is superior medullary pallor. This is the layout. This is the base, right? This is the pontine nuclei. The corticopontine nuclei emerge here, form the transverse pontine nuclei, and they cross it contralaterally, going to the middle cerebellar peduncle. Attachment, main attachment, these fibers, the corticopontine. So then these are the corticospinal and corticonuclear fibers. These are divided by these transverse pontine fibers broken into small bundles. So this is it, right? So then this is the main thing. Okay, so moving on. Next, this is the summary. The blood supply, pons. This is supplied by the basilar and the anterior, inferior, and superior cerebellar arteries. Basilar, anterior, inferior, and superior cerebellar arteries. So applied aspects or the lesions we'll discuss. These are always, you know, so much important is over clinical and applied anatomy. The clinical anatomy is now main focus of every anatomist. So you see medial inferior pontine syndrome. What is that? It results from occlusion of the paramedian branches of the basilar artery. The affective structures are all, of course, which are lying close to the midline, which are the corticospinal tract, medial lemniscus, and this is the abducent nerve roots. What is the result from corticospinal tract nerve lesion? Contralateral spastic hemiparesis. Corticospinal tract, and their lesion will result in contralateral opposite side spastic hemiparesis, and the medial lemniscus is paralyzed. That will result in contralateral loss of tactile sensation from the trunk and extremities. You know, dorsal columns are involved where here we studied that sensory gate, sensory decussation in the medulla, and how this medial lemniscus is formed from the internal arcuate nuclei, from the cuneate and gracile nuclei. This is the abducent nerve roots. The lesion result in ipsilateral, the same side, lateral rectus paralysis. LR6 is a mnemonic, famous mnemonic LR6. LR lateral rectus, 6 is the abducent nerve. So its ipsilateral paralysis will occur. So that is the next, lateral inferior pontine syndrome. That is the anterior inferior cerebellar artery syndrome. What will happen here, of course, lies the more, this is these three things, corticospinal tract, medial lemniscus, and abducent nerve roots were on the near to the midline. As we go lateral, facial nucleus first structure, and what will happen? The ipsilateral facial paralysis, ipsilateral loss of taste from the interior to the tongue, and the ipsilateral loss of lacrimation and reduced salivation. So loss of the efferent limb of the cranial blink and the stapedial reflexes, hyperacusis, so the loudness of the voice. The cochlear nuclei and intra-axial nerve fibers lesions result in ipsilateral deafness. And third is the, in this syndrome, vestibular nuclei and intra-axial nerve fibers lesion results in nystagmus, nausea, vomiting, and vertigo. Then the spinal nucleus and tract of the trigeminal nerve lesion result in ipsilateral loss of pain and temperature sensation from the face, facial hemianesthesia. And this is the middle and inferior cerebellar peduncles are lost, and the lesion result in ipsilateral limb and gait dystaxia. And these 6 and 7 lost in this syndrome, interior inferior cerebellar artery syndrome. The spinothalamic tracts or paralyzed, that is the spinal lemniscus, and their lesion results in contralateral loss of pain and temperature sensation from the trunk and extremities. Spinothalamic tract. Of course, you know the spinothalamic tract carries pain and temperature. The lateral spinothalamic tract, which is a part of the spinal lemniscus. You know, spinal lemniscus consists of lateral spinothalamic tract and anterior spinothalamic tract and the spinotactal. So the descending sympathetic tract lesion will result in ipsilateral Horner syndrome. That Horner syndrome was also produced in the lesions of the medulla oblongata. So that was discussed over here. There the symptoms were discussed over here. So that is the internuclear ophthalmoplegia. This is the MLF syndrome. Medial longitudinal fasciculus is interrupted and paralyzed. It is fibers interrupts the contralateral abducent nucleus that project through the medial longitudinal fasciculus to the ipsilateral medial rectus subnucleus of cranial nerve, third, the oculomotor nerve. It causes medial rectus palsy on attempted lateral conjugate gaze and nystagmus in the abducting eye. Convergence remains intact. This syndrome is often seen in patients with multiple sclerosis, MS. And then this is the facial colliculus syndrome. So what is that? It usually results from a pontine glioma or a vascular accident. Internal genu of the cranial nerve 7. What is the internal genu? This is that part of the cranial nerve 7, facial nerve, which is producing the facial colliculus. And then the abducent nucleus also, they underlie the facial colliculus. There's paralysis. And the lesion of the internal genu cause ipsilateral facial paralysis and the ipsilateral loss of cranial blink reflex, efferent limb. And then the lesion of the abducent, what will they cause? Lateral rectus paralysis, medial strabismus, and the horizontal diplopia. So I thank you very much for this listening, and we'll now continue in the next lecture with our that last portion of the brain stem, that would be our after this medulla and pons, that would be midbrain. So till then, bye.